I'm Kathleen Tusaie. I am an advanced practice psychiatric nurse, credentialed as both a clinical nurse specialist and a nurse practitioner in psych mental health. I am co-editor of two books. The first is, it's the third edition actually, of Advanced Practice Psychiatric Nursing and Integrative Approach. And the other is Fast Facts for Nurse Psychotherapists, the Process of Becoming. And Jeffrey Jones and I wrote that book. So either of those can be a reference if you want more information about resilience, okay? As advanced practice nurses, we are all connected. We have certain experiences and themes as part of our practice, regardless of what specialty or what location we're practicing in. Some of the rewarding experiences include the privilege of being able to share the life journey of our clients. And that's a very special, intimate experience. We also have the opportunity to function more independently and to assist individuals to cope more effectively with their lives. Along the way, we also develop the skill of self-understanding and self-compassion. And further, if we so choose, we can influence organizations and communities by being on boards, by joining different groups, or even perhaps administration and running an organization. However, at the same time, we also are exposed to a wide range of stressors. On a daily basis, we bear witness to individuals suffering. We also have potential stressors that involve clients themselves and their families, insurance providers, it might even involve team members and your environment. Then that on top of national and global issues and our own personal family issues, there is the potential for trauma because chronic multiple stressors can cause trauma. And we do bear witness to human suffering every day that we practice. And we have to remember that how we treat our clients is not only a reflection of our knowledge and skills, but also of our own needs. So the question then becomes for all of us, in today's pandemic world, how do we cope and how do we bounce back from traumas that we experience? As I continue with this presentation, it's important to remember that self-compassion is the foundation of an effective practice. Negative feelings and experiences that are not dealt with when they happen accumulate and multiply and can lead to depression, anxiety, burnout, even post-traumatic stress disorder. So some of the strategies, I'm going to present some strategies that I have found helpful and research has identified as being helpful in maximizing resilience. The first tip is to continue working on your self-knowledge. Now, this has traditionally been a component of education for advanced practice nurses. Back in the day, we were required to be involved in our own therapy. Today, that's an option for most people. But I would guess that some of you are familiar with the term conceptual organizing framework. And if not, I will explain it a little bit and how important this is to our resilience. A conceptual organizing framework pulls from theories. It doesn't have to be just one. It pulls from different theories, and it is your belief, your theoretical understanding of a human being, of the environment, of health, and of advanced practice nursing. And my personal conceptual organizing framework draws from developmental theory, interpersonal theory, and systems theory. This is very, very important because the way we think directs what we do. It directs our behavior. And if you don't know how you're thinking, if you haven't taken the time to identify your conceptual organizing framework and what is directing your practice, there's always somebody around to tell you how you should be thinking and how you should be functioning. Now, that saying is one of my favorites, and it is from my doctoral level professor in my master's program at the University of Pittsburgh. And it's the late Loretta Nowakowski. She took the time and energy to push me to think about my thinking, and she introduced me to Dr. Murray Bowen and systems theory. And I studied with the two of them for a good 3 years, working on my own family, my own issues. And that was quite a while ago, but that lesson is still with me and is my map for practice and my actual rudder, my balancing factor in how I function clinically on a daily basis. So it doesn't matter where you pull the concepts from, what theories, as long as they're consistent with your belief system and you are aware of them. So that's the first tip. The second is self-compassion. I already spoke a little bit about that, but it is so important to recognize your own limits and remember that resilience is not being invulnerable. It's bouncing back. You still have a reaction to trauma, but you're able to deal with it and then bounce back and function at a previous level for you, the level that you were functioning at before the trauma. An example of that for well, I guess any specialty, but especially for a psych nurse practitioner, might be that one of your clients dies by suicide, and you start to have these feelings of helplessness and sadness, and excuse me, it continues until you notice that you're becoming increasingly irritable, cynical, and your people around you that care about you are starting to express concern, and you're not sleeping well at night. Well, it's time to slow down and deal with that. Excuse me again. So what you do is you arrange to have some time off of work and you grieve. You grieve by talking to others around you who are supportive and who you care about and care about you. Might be your peers, it might be your family, or it might be a professional therapist. And you talk about your feelings and you talk about these issues and how they're affecting you. Then you bring some joy into your life, whatever that might be, whether it's playing with children, taking a trip, hiking, painting, music, whatever that might be. And gradually you feel your energy and your strength returning. And then you return to work and you continue functioning with an increased level of self-understanding. That is resilience. That is bouncing back from trauma. The next tip is involving self-care. I already mentioned this a little bit about accepting your limits, but by self-care, I mean actively increasing your level of wellness. The American Nurses Association has started an initiative called Healthy Nurse, Healthy Nation. And what that focuses upon is your level of wellness, nutrition, exercise, rest, general quality of life, and safety, practicing many safe precautions in whatever setting that you are in. Now, one of the really practical, simple suggestions in this initiative involves taking short breaks. During your workday, you might be working 12 hours. You might have client after client after client. And it's important for your own well-being that what you do is you take short breaks, even if it's a few minutes between clients several times during the day, and focus on your breathing. You do some deep breathing exercises. And what happens is you are activating the relaxation response, which decreases your emotional reactivity and increases your focus. So remember to take short breaks. And that might mean just sitting at your desk, not talking to anyone. It might mean going for a walk or going to a quiet area. But remember the deep breathing. Another aspect of self-care is to recognize if there's a goodness of fit between your values, your conceptual organizing framework, your goals, and the goals and values of the system that you are working in. If there's a big difference, you are going to experience chronic stress in many, many ways every day. So if you're starting to feel that there is not a good fit between you and the system, it's time to explore other systems. Or if you are unable to find that, start your own practice. As an advanced practice nurse, that is an option. And right now, that's how I practice. I have a private practice with 5 other therapists, a psychiatrist, and a psychologist. And we are doing just fine. We all have similar thinking. We have similar thinking about clinical care, about how to practice. We think very, very much the same. And there's a lot of synergy and energy that we give to each other during our practices. Okay. Final tip. Build a flame in your practice. Now, I know that sounds a little bit corny, but I'll give you an example. After about 10 years of practicing as an advanced practice nurse, I'm both a CNS and an NP. And after about 10 years, I became fascinated with people's strengths, the traumas that individuals would experience and still be able, often with a little help, obviously, because they would come to see or practice, but that these individuals could function. And why could they function and others not? That whole process of coping, bouncing back, I just became fascinated with it. So I started reading everything I could find, talking with my peers in the practice, who were also my support group. And then an opportunity arose for my attendance in a PhD program. And I just jumped into that, first part-time, then full-time. And my topic of research was resilience. And that passion for that concept has continued all these years. And it's been quite a few years now. But that's part of the reason also that I'm talking with you today, to share the importance of building a flame in your practice, an interest in something, some concept, some technique, even if it's a specific strategy for treatment, whatever interests you, to build on that. Talk with your peers, build a social support group. That peer interaction is energizing, and it's like a safety net. So you need to build that, whether it is virtual or face-to-face. Either way can be very, very helpful. Okay. When you do connect with a support group, with your peers, you need to be careful that it doesn't turn into a session of just complaining, that it needs to be reflecting practice, talking about practice, problem solving, using creative approaches, and then it becomes extremely, extremely energizing and improves your practice. Now, to summarize, the concept of resilience is being used very widely today. And we have to be careful to remember that it's not meaning to be invulnerable. It means bouncing back. And I believe very strongly that every individual has a degree of resilience inside of them, the ability to bounce back from trauma. If you look at the history of the word, it was called homeostasis, it was called successful coping. Today it is resilience. And that term is meaning that we can bounce back from trauma. And it's not who is resilient, it is how much resilience, what degree of resilience does an individual possess at a certain point in time? What is the balance between the risk factors, the trauma experienced, and protective factors, which research has identified to be perceived social support, thoughts about yourself, your self-esteem, your belief in your abilities, certain genetic makeup, which you have inherited, which indicates how reactive you are to situations, your emotional reactivity. Other factors include things like level of intelligence, level of creativity, and adequate resources in the environment, and a coping style that's active, not just sitting back, but being active in how you cope. Okay, so remember that we cannot provide quality care to anyone unless we take care of ourselves. So focus on your own well-being and your self-understanding. Thank you.